Hi guys, in last class we have studied about the low blood sugar. Okay, now we'll learn about the symptoms. Symptoms first appearing Symptoms first appear are shakiness, nervousness, sweating, dizziness, weakness, irritability, and hunger. Okay, symptoms that develop further are slowly are crying, anger, drowsiness, confusion, staggered gait, inability to complete work, blurred vision, and headache. If it's saying if any of the above symptom is seen in any person, they should be treated immediately. Okay, if not treated immediately, more serious symptoms such as increased confusion, delirium, convulsions, and unconscious may occur. If the patient is conscious, we can encourage him or her to eat fast acting carbohydrates, that means sugars, honey, sweet or chocolate, etc., and allow them to rest up to 10 to 15 minutes. Okay, the glucose in the food raise the as I already said, glucose in the food raise the blood sugar levels quickly. Even after taking sugar sweet or something, the blood sugar is not blood sugar levels are not increased then for the second time, and the patient is unconscious, or if a friend or family is unconscious, what should we do? Here saying the individual may need to inject glucagon. I think you guys know about glucagon. Glucagon is produced by alpha cells of islets of Langerhans, whereas insulin is produced by beta cells of islets of Langerhans of the pancreas. What is glucagon do? Exactly opposite or vice versa action of the insulin. That is, glucagon helps in increasing blood level by depleting the stored level of glucagon or glucose which is in the liver. Okay, here that's what it's saying. Glucagon is a hormone like insulin produced by alpha cells of islets of Langerhans. Its action is, as I said, exact opposite of the insulin. What insulin does? Insulin increases the uh, insulin increases the action of cells and increase the amount of sugar that is taken up by the cells, and thus decreasing or lowering the blood sugar level. Here what glucagon does, it helps in depleting the stored glucose levels that is present in liver. Okay, it is saying diabetics should avoid sudden changes in food and consumption, exercise, and insulin dosage. Okay, next one is hyperglycemia, abnormally high blood sugar levels. Okay, maintenance of blood sugar or blood glucose level within or close range has been stressed by all medical authorities worldwide. Even conscientious efforts, there are many times when blood sugar is abnormally high or abnormally low. If these two conditions are left untreated, which can lead to serious problems, as I said, it may also lead to convulsions and delirium also. We already learnt about the low blood sugar, that is hypoglycemia. In the earlier class, I taught about the hypoglycemia. Here we will learn about the hyperglycemia and its extension ketoacidosis. Okay. This condition occurs when there is not enough insulin to meet body needs, and the deficiency is allowed to continue and uncorrected. With high sugar levels in blood, sugar in urine is excreted at high levels. In addition to body breakdown, fat for energy and ketones are ketones are made. Increased production of ketones is known as ketosis, and elevated levels in blood referred as ketonemia. Their increase in excretion in urine is referred as ketonuria. And term ketoacidosis includes all the above disorders which is associated with it. Okay, ketoacidosis is an extremely serious condition which can cause diabetic coma or even death. Onset of ketoacidosis is gradual, but when ketones are present, it is important to test for both glucose and ketones in the urine. See, diabetic ketoacidosis means there are simply three conditions. First, increased blood sugar levels. Okay, and increased blood sugar levels means increased blood sugar level result what it results. That means why sugar is increasing, it should be decreasing na. Why it's increasing? Because insulin is not doing its action. Okay, what will happen? The cells require energy and the carbohydrate are not going to the regular process or glycolysis for the energy production. Even though carbohydrates are available, the cell can't intake or uptake the carbohydrate for energy production. So it results in cell to means it encourages cell to uptake energy from different sources. Then comes proteins and fats into action. First, fat undergoes into energy production. What will happen? Result in breakdown of fat and ketones are formed. Increased production of ketones result in ketosis. Elevated levels in blood, they are present in the blood, that is ketonemia, and increased excretion in urine refers to ketonuria. If these three conditions is seen in patients, it says that patient has ketoacidosis. Ketoacidosis is extremely serious condition. It result to diabetic coma, if not treated, even death also. Okay.